Since the beginning of the pandemic, understanding how COVID-19 affects children has been a priority issue. 9 months into the pandemic, many questions remain, but we're starting to have a clearer picture. We know that children and adolescents can be infected and can infect others. We know that this virus can kill children, but that children tend to have a milder infection, and there are very few severe cases and deaths from COVID-19 among children and adolescents. The data we have show that less than 10% of reported cases and less than 0.2% of deaths are in people under the age of 20. However, more research is needed about the factors that increase the risk of severe COVID cases, severe COVID disease, and death among children and adolescents. And the potential long-term health effects in those who have been infected remains unknown. Although children have largely been spared many of the most severe health effects of the virus, they have suffered in other ways. In many countries, essential services for nutrition and immunization have been disrupted, and millions of children have missed out on months of schooling. We all want to see children back at school, and we all want to make sure schools are the safe and supportive learning environments they should be. The schools are part of a community. In fact, schools connect communities. The measures taken in a community to reduce the risk of COVID-19 transmission will reduce the risk in schools as well. In some countries, schools have reopened. In others, they remain closed. To support countries in every situation, UNESCO, UNICEF, and WHO yesterday published updated guidance on school-related public health measures in the context of COVID-19. The guidance provides practical advice for schools in areas with no cases, sporadic cases, clusters of cases, or community transmission. Given the devastating consequences on children, youth, and our societies as a whole, the decision to close schools should be a last resort, temporary, and only at a local level in areas with intense transmission.